Stanley, welcome. It's always a great pleasure to have you with us. You're still muted, so let me just unmute you. That'll be free. There you are. Welcome. So, Stanley, quick question.
Thank you for having me.
Absolute pleasure. A long-standing friend of Galen Growth, and for a lot of you who were at the summit in 2019, of course, you'll remember Stanley presenting and being what I would pleasantly call provocative, but constructively provocative of entrepreneurs, digital health, and of course the industry around it. Stanley, the first and most important question, is that a real guitar or is that a virtual background?
It's my real guitar, but actually the point is not the guitar. I'll show you. So we are going to have a fireside chat, and this is the fire I printed. Pretend we are sitting beside the fire.
I love it.
Cool. So listen, for those on the call who do not know you, Stanley, your real name, Stanley Li, you're the founder of DXY. DXY was founded in 2000. So you're a .com baby, really, aren't you? You're not really a noughties. You're a .com baby. So as I understand it from the discussions we've had before, DXY is China's largest physician social network. In fact, probably safe to say the world's largest physician social network. Last time you and I spoke, you claimed 2 million plus physician members. I'm sure that number's grown since, particularly with COVID. So I look forward to hearing all about that. You hold a master's degree in tumor immunology and a PhD in neurology. So you're extremely well placed for this conversation. We won't spend an enormous amount of time on tips and tricks. As Helen rightly pointed out, we plan to run a series of webinars to talk about tips and tricks. What I'm really interested in knowing is how you, your team, DXY, are taking the fight back to COVID-19, particularly in China. Before we dive into that, though, let me give you a few minutes to talk about DXY. What is it and why is it the best?
Okay, thank you for your question. DXY was built up about 20 years ago. At that time, I was still a medical student. So the purpose actually for building up DXY is trying to help my roommates, my classmates, to understand how to use PubMed. PubMed actually is literature searching tool for scientific articles, but PubMed was a little bit complex. It is still very complex compared with Google. So very few people at that time knew how to use PubMed. And DXY was trying to introduce the skills or tricks for using PubMed in a more efficient way. And after introducing PubMed, we realized that doctor actually is a lifetime learning process. You cannot be a doctor when you graduate from medical school. You have to learn a lot of knowledge from real practice. So we built up online community for Chinese doctors to share their clinical cases, to exchange their clinical experiences. So this is a very effective way to improve yourself. And after that, DXY also extend our services to the pharmaceutical companies, to the hospitals. So we help the hospitals to recruit talented doctors because DXY has become the largest talented pool for doctor. And also we are helping pharmaceutical companies to deliver their key message, deliver their educational materials in a more precise way to the individual doctor. So basically these business build up the DXY's foundation. And about 5 years ago, we realized the demands for health lifestyle is rising in China, especially among the so-called middle-class Chinese people. So 5 years ago, we extend our services to the consumer side. Our vision is more health and a better life. So we position ourselves on the healthcare side and by providing trusted knowledge, useful tools to facilitate users and consumers to have a healthy lifestyle, to become more healthy and wellness. so they can enjoy their life based on our services and products. And so in the past 5 years, we have touched over 130 million users in China. So the number is still growing. And these are the basic introduction of DXY. So if I can, I will share our expertise about fighting with COVID-19 in the past 2 months.
Absolutely. So let me just step in 2 seconds though, Stanley. So now you've set the context. What we'll do is we will go through a series of questions, including, of course, you taking us through the journey you've been on the last few months. However, let me encourage the audience to ask questions using the Q&A, because at some stage we will start taking some of the questions from the audience, and I will read them out to you, Stanley, and you can answer them, so you don't have to worry about fiddling around with your computer. Okay, sure. So if we go back in time a little bit, last time we saw you in Singapore was in November at the summit. And at that time, of course, we were talking about the old normal. And of course, COVID hadn't reared its head at that stage. Then late November, certain systems started detecting a rather odd case of influenza growing in China. And then really no one paid attention until January. So what happened?
In January, we do notice that there is some rumors or information collected from Wuhan said severe disease is spreading. But at that time, we have very little information about that. We don't know what it is exactly, but just felt something worse was happening. So on the day of January 20th, actually that was the last working day before Chinese New Year. And we decided to build up emergency team to manage this situation. So still at that time, we don't have enough information, just based on our instinct from our professional background. So first, we believe under such circumstances, transparent and comprehensive information will be very helpful to the public. So we decided to deliver as much as we could to educate the public about the disease, about self-protection. And our first product was disease tracker. And I believe this is the first disease tracker in the world. And it goes live on January 21st, just 1 day after the emergency team. So our purpose was trying to collect the data from the public side, from public sector, and try to deliver the public as much as we could. So the disease tracker, I think, become a very huge traffic resource that many people and many press came to us to look for the data at that time. And yeah, so the disease tracker really become over a blockbuster application at that time. And after that,
let's drill into that. Sorry, let's drill into that tracker then. So let's start with the first question though, Stanley, which is, why did you feel compelled to build it?
You know, when something bad happened, it's a sort of like, hold my beer, let me fix it. I think it's based on over professional training over decades. I have been trained as a doctor for over 12 years. I received a very comprehensive and extensive education and scientific training. So it's just over very basic reflection that we need to do something, and it has to be us, because DXY's team is composed of medical professionals, CDC guys, public health guys. So we have the obligation to do something, even the Chinese New Year is coming. So we decided to start from disease tracker. This is probably the most optimal way to deliver the message and the data to the public and release the anxiety of the public.
Okay, makes sense. And so how did you go about setting this up then? You just suddenly ring all your team up, pull them into one room? I mean, you talked about it being done in 24 hours, which is an amazing feat, but how did you get there?
No, actually, the second day, January 21st, was vacation already. So people, all the employees already went out for vacation. They went to Singapore, US, Taiwan, UK, or go back to their hometown. So it was very challenging for us to coordinate remotely. But after we organized the emergency team, we used the WeChat to deliver our decisions, to collect our employees' feedbacks. Around 20 or 30 people actually were involved at first time. So on the first several days, we just focused on the disease tracker and try to make data in a more comprehensive way, because at that time, actually the data was from multiple resources in a very inconsistent format, in a Word, in a PDF, even in an image file. So it caused a lot of trouble to clean the data and deal with all these kind of data. So this is the first several days. And after that, we realized only disease tracker may not be good enough, because we do notice the disinformation and the misinformation, and also the great needs, the great demands for knowledge. So we went to the second step. We co-work with the doctor from our community, and we generated content, educational materials to talk about what kind of disease it could be, what kind of virus is single-strand RNA virus, but very few people know its meaning. So we have to generate a lot of contents to educate the public, to relieve their anxiety, and also debunk the rumors. The rumors never, the disease spreading is never in its isolation. It always alongside rumors, misinformation, disinformation, conspiracies, sort of things. So we have to do something to generate trusted and credible contents to debunk all these misinformation, to against not just the disease, but also the infodemic.
No, absolutely. And those insights are no doubt been incredibly valuable for China, for the bigger world. I mean, I certainly was most impressed when the link was being shared virally, really, to the tracker. But of course, what we saw was the finished version of the tracker with all its bells, whistles, and maps and red bubbles, etc. But it was very nice to see the DXY link at the bottom. But I'm assuming the first version didn't look like that.
No, actually, the first version was very simple, very ugly. The map we are generating actually is just a static picture. Mm-hmm. It's not a dynamic change. It's not a responsive design. Mm-hmm. Because our team members thought, okay, I just finished the static map. That I can go to my hometown to have the Chinese New Year. So at that time, nobody realized it go so badly and so quickly.
True.
And after several days, we realized it's quite out of control, and we decided to put more resources, more human, to optimize the map. So we input more people, and you can see in our group the number of people were growing from 20, 30 to up to 50, 60, even close to 100. So we kept recruiting more people even after they go vacation, even after they come back to their hometown. They have to participate in this emergency work. They have to be working with us remotely.
So let's switch gears a little bit. Delivery of healthcare is massively impacted by the measures that have been brought about by most governments to fight COVID-19. And it's a series of various words being used, but I think the latest trend is lockdown. So certainly China demonstrated how lockdown is done, and did that very early on. How did you then look at DXY and your massive network of physicians who no doubt had a lot of questions, but also wanted to help their patients out? How did you step forward and help these guys, these physicians, be able to, deliver healthcare?
I think it is still quite like our routine work for developing internet products. When you have some ideas, you test out with your demo, and you collect the feedbacks, analyze the data, and try to understand the user's insight, and keep optimizing your products from a demo version to a more formal version. So it's quite like our routine work. We started from a very quick and very simple product, disease tracker. And after that, we realized there could be more demands from the public. Then we generated content. And after that, we also realized the doctor's demand is also huge for learning the knowledge. And then after that, we collected the doctors and generated online curriculums, online courses to educate more doctors and the nurses to learn about disease. And after that, we realized that the patient, the consumers, they may have the demands for asking questions. So step by step, we moved from the disease tracker to the content and then to the online consultation. And the interesting part is it is quite in line with our strategy. Last year, when I was in Galen Growth Summit, I shared our experiences in terms of ICE model, from information to consultation, then to engagement. So this is a kind of funnel shaped model. The first level is information, second level would be consultation, and the last level will be engagement. So through this model, you can see actually health service is integrated and a continuous service. It's not just only about consultation. It's not just about only the information, but all these three things should be linked and integrated together. And through our service, we also observe a very similar thing that, on the information level, there are a lot of concerns and questions in common. So when we write articles, when we created our video clips about all these common concerns, and very few people will go to the consultation level. So I can share you some numbers, some data we have on the disease tracker. We have acquired over 3 billion visitings. On the content level, we have acquired over 4 billion readings. And these over 7 billion readings actually are a huge traffic. So most commonly asked questions, most commonly concerned actually has been answered on this level. And go to the consulting level, in the past 12 months, we collected about just 1 million online consultations. So wow. You can find out actually most concerns and questions already be solved on the first stage. If DXY has not information services, even we are the largest physician community, even we have the capability to collect all respiratory disease doctor, all the ICU doctor on DXY to answer the question. At that time, when people in panic, hundreds of millions of people come to us, and we cannot handle that. So this is also kind of hierarchical structure that filter out most common concerns, anxieties, and only provide the service to the most needed or most customized questions. So I think this model works still very well during the pandemic.
Cool.
So that
did you have to adjust any or adapt anything of your solution because of COVID-19 and then the role you were trying to play?
No, actually, all these thoughts were retrospective. Our strategy actually was already set up about 2 years ago about information, consultation, engagement. And in this pandemic, actually, what we have learned is we have been testing our strategy works. And from the retrospective perspective, that when I look back in the past 2 months, actually our routine is just to follow the ICE model from data, then to the content, and then to the consulting.
Interesting. So let me just therefore look at the broader environment you're sitting in. So there you are, attempting to deliver as much as you can to enable the delivery of healthcare in China. But I'm assuming, therefore, you also started seeing gaps, or I guess elements of that delivery of healthcare that you weren't able to address with the existing DXY business model. So what were those, and how did you go about, building, I guess, the right partnerships to try and fill those gaps and therefore be able to take a better solution to patients or even physicians for that matter?
That's a great question. Actually, if I look back, I can say there are three things I found out, which is not very good, even from both the public sector and the private sector. The first is the CDC's position actually is not addressed in China. Actually, CDC's budget is not enough, and a lot of talented people are leaving CDC because their salary is very low. And after SARS, which happened 17 years ago in China, CDC, the CDC's position is getting lower and lower. I mean, their budget and their talent people. So I think this is a very big issue that in China, the CDC's function actually is not played very well. Probably it's not just a question from China. In US, we also see the very similar things. The CDC is going down. It didn't play a very well role. So this is the first thing. The second thing is, in China, most hospitals actually are public hospitals. There are tier 3 hospitals, but the basic medical service is not sufficient. The basic medical services like GP or general clinics actually is not well funded in China. And one thing is, about 5 years ago in China, we don't even have GP. If we can take Singapore as an example, Singapore has public health preparedness clinic. So this is there are around 800, 900 clinics which can play a very important role during the outbreak. They can give patients care. They can guide the patients how to protect themselves. But in China, basic medical service is very, very insufficient. So many patients, they were flooded into the hospitals and drained over medical supply. So I think this is the second problem. And the third problem is, the interesting part in China is we inherit the former Soviet Union medical education system. So the whole Chinese doctors group actually are educated as specialists, but not GP. So, many doctors and nurses, they don't have the infectious disease education. They don't have epidemiology education. They only focus on a very specific disease. So when they first, if we can go back to the January or late December last year, when some patient appeared, many doctors, they didn't realize it could be an epidemic. They just treated like ordinary pneumonia or respiratory infections. So the doctor's education about epidemic, about some infectious disease is not enough. So from the DXY side, first, we would position ourselves as the public health service provider. So even after the pandemic disappeared, we still will keep a small team to be a watchdog, to keep watching the latest pandemic trend or some cases in China or globally. Because with the flight, the pandemic could happen after hours. And also with the climate change, we do see a lot of tropical or subtropical disease are starting to move to north. Like let's take malaria as an example, or dengue fever. So it used to be only happen in South Asia or even Africa, but we do see the malaria and dengue fever happen in Hangzhou or even North China. So DXY will keep that team as a watchdog to monitor the latest CDC trend and their information, the data, to be a warning for the public health. And secondly, we will involve into the doctor's education. We will invite the key opinion leaders or professors with the public health background, CDC background, epidemic background, to teach the doctor and nurses to tell the disease from the ordinary disease and also the epidemic disease. So this is very, very important, and we are already doing this now.
Great. And so building on all that capability, I'm certainly looking forward to seeing your regular updates on pandemic risk, or epidemic risk, at least going forwards. What sort of partnerships have you considered or even built in order to broaden, I guess, your value proposition to physicians and to patients?
Actually, I can give you two examples. The first example is our partnership with Huawei. Huawei is cell phone manufacturer in China. So we output our data, our primary data, to Huawei, and Huawei's users can monitor the data change on their cell phone. So this is a very easy collaboration. We opened our API to Huawei, to Johns Hopkins University. Johns Hopkins is also using our data as their resource, and to the WHO China office. So these are the API collaboration with the partners from both public sector and private sector. And another example is when the pandemic, actually when the epidemic goes to the late stage in China, and many people are concerned about taking public vehicles such as subways, buses, ride sharing services, because they are afraid of getting infected. So we generate content and we co-work with Didi. Didi is the largest ride sharing service platform in China.
Yeah.
So we generate content to educate the consumer, the public, how to avoid being affected during their trip with using the ride sharing service. And even they have some concerns or they have some slight symptoms, they can also use the button integrated in Didi to transfer into DXY's online consultation platform. And they can ask our doctors to receive some suggestions and instructions.
Fascinating, and I was not expecting the Didi reference. Huawei, of course, most of us have heard of. Apparently, they do a bit of 5G as well. Quick question for you, very technical, from Ricken. Ricken is asking you, what has been the experience of serological tests, IgG, IgM, rapid assays, in China, and how specifically have the government deployed them? Is this something you're comfortable on? I'll reread it. What has been the experience of serological tests, the IgG or IgM rapid assays in China, and how specifically have the government deployed them? Is this something you're comfortable answering?
Question. Yes.
Yeah. Okay,
yes, I see the question. Actually, IgG, IgM, they are antibodies, right? They are not the rapid assays. Antibodies appeared after weeks, so I don't think it's a rapid assay. But still, the Chinese government is trying to launch the serological tests to collect the confirmed cases. But on the very first beginning, there are a lot of rapid assays, such as taking the examples from the throat, from the nose to test out. And also, the Chinese government found out the false positive of the false negative is very high. So in our guideline, they also combine the CT imaging because the CT imaging is also a very useful way to detect the coronavirus. Mm-hmm. So in China, actually on the early stage, the combination of both CT imaging and the samples from throat, they are combined together to make diagnosis. But still, there are some suspected cases left behind. So that explains why in Wuhan, there are a huge population infected. Even after the hospitals and the Fangcang shelter hospitals open, there are still a huge number of population getting infected. So it's really a very difficult job to test in a very accurate way. But the government actually showed their power to collect all these cases, even suspected cases or even the mild cases. So they the government put these guys into the Fangcang shelter hospital to receive the treatment or receive the isolation. So I think, from my perspective, I think the serological tests are still needs more time to develop its technology because it's still the false positive, false negative. These are still very big problems.
Yeah, no, I think you're right. And I think many nations across the world are seeing that challenge in terms of the reliability of these and false positives too. Switching gears, question from Flora for you, Stanley. We talked about partnerships you've built now, the DD and the Huawei, and I know there are others as well, but Flora's asking, what kind of partnerships are you considering in the future to take the game to the pandemic?
Yes, that's the right question. I would say align with our strategy, like our former speaker mentioned. This is the real partnership I want. DXY position ourselves as healthcare provider. When we talk about healthcare, it is very interesting that in China, when we say healthcare, it always including the medical part. Actually, the medical part is very different with the health part. So actually, DXY gave up the sick care, and we moved to the healthcare. Mm-hmm. So we only focus on the lifestyle, on the wellness, on the publics. We don't just focus on the patient because, like a lot of speakers mentioned, the patient or digital therapeutics, they're facing huge regulations, and also the medical requirements actually is very low frequent compared with the healthy lifestyle. Mm-hmm. So we position ourselves on the health, on that lifestyle, on the wellness. Mm-hmm. Our mission is to deliver our professional strength with the collection of the doctors and translate that language into the context and language which lay people can understand, and help these guys improve their lifestyle. I think this is very meaningful, especially after the outbreak. We do see many Chinese people, they focus more on their lifestyle. I think the influence is profound and inevitable.
Interesting point. Continuing on the topic of partnerships, I know that one particular dialogue is ongoing because Galen Growth has been instrumental in putting you in contact with a large US pharma company, which precisely that conversation around how does a big pharma partner with successful proven digital health startup, or in your case, scale up, with a view to obviously taking a better value proposition to patients. How has, in your view and your experience so far, how has the corporate, the manufacturing side, the payer side, been reacting to COVID, and how have they been reaching out to DXY, for example?
Well, I can share with you data. We have online webinars. We used to provide it to the pharmaceutical companies for their key opinion leaders to deliver educational materials online. Mm-hmm. And in the past 2 months, the demands from the corporate, from the pharmaceutical companies has risen over 900%, mm-hmm. 9 times with last year. I quite agree with your point, a new normal. This is new normal. before that, you know, the digital channels or online education, it's just an alternative way. But now it seems like to be a mandatory way because medical reps, medical liaisons, they cannot go to the hospital now. They cannot have face-to-face communication with the doctor as before. Even after the outbreak, I don't think the pharmaceutical companies will still send out a huge number of medical reps to the hospitals to meet doctors. So I believe the epidemic has changed a lot and also bring us a new normal that digital channel and online marketing has become a mandatory way, not just an alternative way like before. So
Absolutely.
we are still working closely with the pharmaceutical companies, and we are trying to do the online doctor education and online marketing access and online consumer users engagement, including some chronic disease patient, because they're also concerned a lot about their lifestyle.
Thank you for that, and I'm looking forward to hearing more on that in the coming weeks. Listen, we're constrained for time because we have a time contract with our audience. So I'm going to ask you one last question, Stanley.
Okay.
A bit more philosophical, this one, but certainly builds on everything you described, and it's come back to this new normal. I don't know if you heard, but at the beginning, Galen Growth shared his point of view, which is that we are in a new normal, and certainly digital health is now an imperative for both public and private sector. Now, interested to have your reaction to that. And I guess, you know, do you believe fundamentally that COVID-19, in fact, is to use Schumpeter's words, the creative destructive moment for digital health?
It is. I think my answer is yes. From my perspective, I would like to address this question from two directions, internally and externally.
Please.
So from external perspective, like I have mentioned, the digital health has changed a lot of people's mind, even changed the government's mind. The Chinese government used to be very conservative about online health, digital health. But in the last 2 months, the central government released at least 3 new policies to encourage online digital service. And released the insurance policies to encourage online payments for online consulting. And also from the internal side, I do see from our team, you know, some people, the employees, from the employees' perspective, many people also realized our value in terms of providing online consulting, online knowledge, online education, or broadcasting services. I can give you an example. In last year, our broadcasting team, which serve the pharmaceutical companies, they told me their job was very boring because they just doing the online broadcasting over and over again. I didn't realize the value, but in the past 2 months, they really found out the things has changed, and a lot of doctors, medical workers came to us and learned our curriculums and leave a lot of feedbacks and messages to us. So we really feel very encouraged from our users and also from the corporate. So from external point and also the internal point, we do believe the disrupting point or turning point of digital health has come much, it could push the industry in a much faster way than we expected. I
completely agree with you, and Galen will continue exploring that very topic and sharing with the ecosystem as a whole, be it investors, be it manufacturers or corporates, and of course startup entrepreneurs, how this is shaping, how this is developing. over the next few months and possibly, of course, years. But it's always a pleasure to have you with us, Stanley, and always very refreshing to get your insights and points of view, and particularly looking at it from the China perspective. I must admit that it's always refreshing to have a balanced point of view rather than some of the xenophobia that's flying around this whole COVID-19 topic in China. So congratulations on the hard work to you and your team, and keep taking the game back to COVID-19. We will beat it. Thank you, and I'll hand back to Helen.
Thank you. Yeah, the pleasure is all mine. Thank you very much.
Pleasure.
Thank you, Stanley. There was one more question for Stanley, but I think that we will send the question directly to Stanley afterwards. All right, well, thank you very much, everyone, for joining us today. It was a great pleasure to be able to host this Deal Factory session with all of you guys, and we really hope to see you again in June. Do reach out if you have any question or any support that you might need on any specific aspect on digital health. We are always there for you. And in the meantime, stay safe, stay home. Thank you, everyone.